Good morning, good afternoon, Sabah al-Khair, Masa al-Khair. I am Rima Salah, the chair of the Early Childhood Peace Consortium and the former deputy executive director of UNICEF. It is my honor to welcome you to the C20 Summit. The C20 is an independent group of the G20 and is a global platform for civil society organizations in the G20 process, delivering civil society's demand to the world leaders. It is also my pleasure to welcome you, and also on behalf of my colleagues, to the Early Childhood Peace Consortium panel session, Response to COVID-19 for Children in Fragile and Conflict-Affected Settings, the Promise of the Early Childhood Development. A few words on who we are. The Early Childhood Peace Consortium is a global movement of United Nations agencies, non-governmental organizations, academia, practitioners, and the private sector focused on sharing scientific and practice-based evidence on how investment in early childhood development can contribute to sustainable peace, social cohesion, and social justice. Today, we have with us eminent and renowned panelists to talk about their achievements and contributions in science and practice to early childhood development and peace would require more time than we have now. But I invite you to look at their bios in our website. Our first speaker will be Dr. James Lackman, who is the Nelson Harris Professor in the Yale Child Study Center and Professor of Psychiatry, Psychology, and Pediatrics at Yale University in the United States of America. Dr. Siobhan Fitzpatrick is the chairperson of the International Network in Peace Building for Young Children and the former chair of Early Years, the Organization for Young Children in Northern Ireland. Ms. Nadal Attar is Early Childhood Development Specialist in Emergencies at UNICEF headquarters in New York. Dr. Ghassan Issa is the General Coordinator of the Arab Network for Early Childhood Development and the Director of the Arab Resource Center Collective in Beirut, Lebanon. Dr. Anna Tenorio is the Global Technical Director for Education for World Vision International, and she is based in Dakar, Senegal. I will start by giving now my introductory remarks. Excellencies, distinguished participants, I am privileged to have the opportunity to talk to you on a subject that concerns us all in these very critical and trying times, to guarantee the right to child well-being, care, and education in the response to COVID-19 and beyond. In this year 2020, let us start by celebrating the children of the world, the children in every region, in every country, in every village, and in every refugee camp. As we commemorate the 30th anniversary of the landmark Declaration on Education for All, launched in Jomtien, Thailand. In the declaration, the world leaders and the international community, supported by the Universal Declaration of Human Rights and the Convention on the Rights of the Child, asserted that all children, young people, and adults have the human rights to benefit from an education that will meet their basic needs so that they improve their lives and transform their societies. They also emphasize that learning begins at birth, which calls for early childhood care and initial education. In April 2000, 10 years after the World Education Forum, met in Dakar, Senegal, and adopted the Dakar Framework for Action. The participants hailed the commitments made by the international community to basic education throughout the 1990s and committed themselves to the achievement of education for all goals, for every citizen and in every society. The goals included expanding and improving comprehensive early childhood care and education, especially for the most vulnerable and disadvantaged children. And by 2015, all children, particularly girls and disadvantaged children, have access to and complete free and compulsory primary education of good quality. As we also commemorate the 31st anniversary of the Convention on the Rights of the Child, which is the most comprehensive statement of children's rights ever produced and the most widely ratified international human rights treaty, we can rightly celebrate the commitments of the world leaders, the international community, and civil society to the right of every child to survival, to development, and to protection. We can also celebrate the impressive gains achieved for the children of the world. The global mortality rate for children under 5 years of age has declined significantly, and also more children are going to school. More countries have translated the International Convention on the Rights of the Child Treaty into their national laws and policies, ensuring that all the children enjoy all the rights. Unfortunately, progress has occurred only for some, leaving millions of other children left behind, with the rights to thrive and grow to their full potential denied. We know that 43% of all children in the world are at risk of not achieving their development potential. The risk factors include poverty, poor health, abuse and neglect, exploitation, as well as inadequate care and lack of learning opportunities. This is now compounded by the situation of war, protracted war, violent conflict, military occupation, and displacement, to which families and children are exposed, disrupting the fabric of their societies and compromising the very foundation of their institution. A Save the Children report in 2019 says that more children than ever before, at least 420 million children live in conflict zones, and 250 million children are living in active conflict. We know, according to UNICEF in 2018, 29 million babies globally were born in areas affected by conflict, and 53% of under 5 deaths take place in settings of conflict and displacement. As we know, this is also a time of unprecedented displacement of more than 80 million people, primarily women and children. 28 million children, according to UNICEF, have been uprooted by horrific violence. Those children are exposed to exploitation, violence, abduction and detection, xenophobia and discrimination. The COVID-19 pandemic is exacerbating their situation and existing crises around the world, and where inequalities are becoming starkly evident, further violating the rights of vulnerable children. The pandemic severely affects young children's physical, mental health, their social and emotional development, safety, economic security, and access to education and recreational activities, leading to unprecedented crises of care and learning. With the disruption of health services, vaccination services, and limited access to nutrition, it is estimated that more children will die. Children and school closures kept millions of children out of school, and too many remote learning is out of reach. Further, Childcare and school closures eliminate early warning mechanism for child abuse and neglect, detection and reporting. Hence, there is an urgent need to protect children from violence amidst the pandemic. Most worryingly, the exposure of parents to instability and challenges stress their ability to provide for their children who need their protection and nurturing care. What is even more alarming and should concern us all is the lasting negative impact of deprivation and violence on young children and how these detrimental effects will eventually affect our societies and communities. But we can say with confidence that advances in development neuroscience and other multiple disciplines hold significant implications for the millions of children that are left behind. Then the good news and hope is that the emerging science heralds new era with great opportunities through investment in the early development of young children as a path, creating a culture of peace and sustaining peace at home, in the community and society. This is why the Early Childhood Peace Consortium is convinced that early childhood development strategies and services are now more than ever important to mitigate the immediate and long-term impact of COVID-19 crisis on the most vulnerable children and their families. Supporting and empowering them today can only not interrupt cycles of deprivation and inequality, but build a strong foundation for peace, resilience, social justice, and social cohesion that encourage quality community engagement and solidarity, that create a sense of belonging and inclusion, and also promote their trust in their institutions and promote their trust in their governments. For this, we entreat, in this regard, we entreat the world leaders of G20 and governments to safeguard the rights of young children living in fragile contexts and prioritize investment in their survival, development, and protection so that they and their families live in peace and dignity. We ask the world leaders to uphold their commitment made in the 2018 initiative for early childhood development. We appeal to the world leaders and the international community to protect and prioritize investment in early childhood care and education in the response to COVID-19 and beyond, towards a universal access to early childhood services, leaving no child behind. It is our shared responsibility to invest in the future of every child for a more peaceful and just world. Let us commit ourselves. The time is now. Thank you. And now we start with our panel. We start with Dr. Lackman. Why? With the first question, and second also, why is there higher risk to young children's development in fragile situations? What are the long-term impacts of this on children's well-being and learning experiences? Now, with the COVID-19 global health emergency and the correlative economic crisis, what are the consequences for young children and families? How do we mitigate these consequences?
So can everyone see the screen?
Yes, Jim.
Well, it's a pleasure and honor to be here. Thank you, Rima, for the introduction. And I'd like to thank my colleagues from around the globe. It's been quite remarkable for me to be able to participate and to actually listen in and observe some of the panel sessions that have been continuing over the past several days. And I will answer Rima's questions in just a few moments, but I'm just going to go through my slides, and I'm so honored to be part of the team. And the title of my presentation is Pathways to a More Peaceful World, the Transformative Power of Children and Families. And I guess I was reminded as I was watching some of the panel discussions yesterday, just how interconnected we all are, whether it's through Zoom or through in-person meetings. But what we know is that we are all deeply interconnected in this ever-changing world of ours. But what's also fascinating is that if you look at what's happening in our brains, it also turns out that that's all interconnected and ever-changing. And I should have a little video here of just the activities of the neurons, but one neuron doesn't do anything by itself. It's only when it's interconnected with other neurons that it matters. And remarkably, some of those circuits are formed very early in development, even before birth. And it's remarkable how that can have a sustained impact. That said, there are other periods of time where there's also remarkable growth and transition, but there's also an opportunity for resilience. Just because we were born in a particular way under stress doesn't mean that we are going to have a brain that is forever affected by that. It certainly will have its impact. And I guess I've also been fascinated, although I don't know that much about physics, that when you look at some of the simulations of the cosmos in terms of dark matter and dark energy, what you also see is that this is ever changing and deeply interconnected. So I'd like to start with just a few perspectives. These are some people that I have great admiration for. Here's Mahatma Gandhi. If we were to teach real peace in this world, if we are to carry on a real war against war, we shall have to begin with the children. Nelson Mandela, there can be no keener revelation of a society's soul than the way in which it treats its children. And I probably should have Martin Luther King Jr. here, but given what's happening in our country. But here is a picture of Ed Ziegler, and one of the links that people can find is actually a paper that we wrote in honor of Ed Ziegler, and I think it has 24 different authors, and it reflects some of the international work that we're currently doing, focused on early child development. And to be totally committed to the optimal development of each child is key. Good parenting benefits the community as well as the kids, and it is the environment that determines a considerable part of the development of the children. I would also say that Ed was very clear in terms of his advocacy, mostly in our country, in terms of trying to have an impact on policymakers. And one of the fascinating things that Ed taught us was that what really matters, what people listen to, are some of the stories that people have been going through and what benefits they've received from the intervention. So Rima's first question is, why is there a higher risk to young children's developments in situations of protracted conflict, military occupation, and displacement? And what is the long-term impact in terms of the child's well-being and learning experience? And here I would have to say that if you review the science, what you will see is that that's already well established. There have been numerous sort of classic studies where you're looking at randomized controlled clinical trials where people have actually followed what the impact of those programs are for generations, at least going up to 20, 30 years beyond that. And what's fascinating is we were also had the opportunity to contribute to one of the Lancet's special issues with regard to advancing early child development from science to scale. And I was honored to be one of the authors of the article, the summary, the review that was prepared by Pia Brito and a number of our other colleagues. And this is basically one of the figures from that review article that we did. And it basically reflects interventions through the life course. And as I mentioned before, what happens very early in development, even during the pregnancy and the very first years of life, is critically important. But certainly the well-being of the parents as they prepare for the birth of their child is also critically important. Rima mentioned the components of nurturing care, and let me just review exactly what those are. It's finding ways to provide the adequate health care that's needed, having adequate nutrition, and it's really just so tragic when we look around the world today, and this is actually one of the articles that you'll see if people look at some of the URLs that you can find, in terms of just how many children are now living up in such dire poverty that they don't have adequate nutrition. Critically important, and one that I care deeply about in terms of being a child psychiatrist, is responsive caregiving. Here in this context, of course, security and safety is critically important, given what Rima was mentioning in terms of the realities on the ground around the world, and of course, opportunities for early caregiving and early learning. And what was interesting is I was listening to one of the panels yesterday with regard to social emotional learning, and I guess I really found that quite moving, and I do hope that we can make some connections with some of the participants in that panel with the Early Childhood Peace Consortium. So one of the elements that is probably obvious to all of us is that parenting is key. And this is actually some of the work that I've done in animal studies and some of the reviews that I've done. But let me introduce you to my daughter, Emily, and my oldest grandson, Caleb. And I'd like you to take a look at the sort of exchange of eye glances there in terms of the sort of synchrony that you see. And it's one of my great pleasures in life, even though I am a bit of an old man, to have 4 wonderful grandchildren, and Caleb is the oldest. So I'd just like to mention the book that Rima Sala and I edited, along with, I think, at least 44 other colleagues around the globe, in terms of, this is Pathways to Peace, and this was one of the articles that the Ernst Strugman, and they brought us together in Frankfurt, Germany, to have a discussion about so many different aspects of early child development, looking from the basic science all the way to practitioners and what was happening around the globe. In addition, I just mentioned some of the work of James Heckman. In addition to the effects of positive parenting and interventions, there's also a very strong economic argument that if we invest in early childhood, we will actually have the highest return in terms of human capital. And programs that are targeted towards the children's earliest years have the highest return. And what he did was he went through and looked at some of these long-term studies, these prospective long-term studies, and looked at the outcomes and assessed what the financial impact of those programs were. And as you can see, interventions at the very earliest period of time in development can have the biggest impact. So one of the aspects of the questions that Rima was asking was, what about living in fragile and conflict-affected areas? And of course, the other reality apart from, and she was mentioning a good deal of this reality as well, many children do not receive adequate nurturing care. And this reality is compounded by situations of war, conflict, and migration, which families are exposed to. And it's sad but true that more children than ever, and this is probably the much higher figure now, are now living in areas affected by conflict. And in addition, every year, hundreds of millions of children are exposed to and are victims of domestic violence, many of them exposed at a very early age. And this actually comes again from the team at Harvard with Jack Schoencroft about toxic stress, that over 200 million children under the age of 5 will likely fail to reach their full developmental potential because they're growing up in the context of what he refers to as toxic stress. Poverty, poor health and nutrition, high levels of family stress and exposure to violence, abuse, neglect, exploitation, and inadequate learning opportunities. So what can we do? So the case for the importance of early childhood development has been made, and as a field, we need to do more. We need to make sure that every child receives adequate nurturing care. And for me, it's always one child at a time. So let me just very briefly mention some of the international projects that we've been working on. And wonderfully, one of them is actually taking place in Saudi Arabia. Here is Professor Maha El Monif, and she's actually implementing a program that we've also implemented in Lebanon, as well as in Brazil. And it actually grew initially out of some of Ed Ziegler's work, but then it was sort of created into this program in Turkey. And wonderfully, one of our colleagues that we'll be hearing more about is Dr. Ghassan Issa, and he was actually the person with the Arab Resource Collective that actually implemented this program. And he will tell you more about that during his presentation in a few minutes. But basically, they brought together groups of mothers. And in this case, it was actually two communities that were Palestinian refugee communities, as well as a poor district in Beirut. And wonderful team, wonderful curriculum, 25 sessions, and some very impressive findings that were the result of that. But it's been wonderful. And if you actually go to his website, you can actually see some of the discussions that he had with some of the mothers that were involved in the piloting of that program. And we need to address the needs of children and parents, particularly in conflict-affected areas of the world. And if we take this action, we will build a brighter future and a more peaceful world. And this could not be more timely as our society and as our world grapples with COVID-19. So what about COVID-19? Let's move on from there. And basically, it has further exacerbated the existing challenges that many families and societies face in terms of being able to provide adequate care to their children, and we all know that to be a reality. And we need to work in conjunction with communities, governments, non-governmental organizations. All of us need to work together to ensure that all children are living in safe locations and that they are receiving adequate nutrition and loving care. So next steps in Beirut, we all know about the devastating explosions that have occurred, that did occur in that city. And it's really quite unfortunate, but let us move ahead. And given the current realities on the ground and the ongoing pandemic, they've actually put some of their in-person early child development programs on hold. But they also, fortunately, Dr. Issa and his team have been actively developing and implementing virtual online programs for parents, children, and educators. So that's something that we can be very grateful for. And of course, they need our support. So one of the pleas that I would make is that if you have any interest, I would really strongly recommend that you contact Dr. Ghassan Issa and find a way if you can actually provide support for their initiatives. So my take-home message is that we need to take action to make our world a better place for our children and for future generations. And as I said before, one child at a time, from generation to generation. And next steps include a commitment to refine and implement in a sustainable fashion early developmental programs of proven value across the globe. So we all need to work together internationally to build a more peaceful and sustainable world. And I'd like to express my thanks for everyone's attention today, but especially to the other presenters, especially to the C20 group, but also to UNICEF, ACEV, the Mother Child Education Foundation, which is the group in Turkey, the Early Years Organization, and I'm looking forward to Siobhan's presentation. Queen's University in Belfast, this is one of the organizations that's been working with us to pilot programs around the globe in conflict-affected areas. And if we went back to that slide where I had all of the other sort of global panorama, those are some of the countries that we're currently working on. And wonderfully, in that article, if you want to read it in honor of Ed Ziegler, where we have 22 authors, we also have representatives from many of those countries, Tajikistan, Kyrgyzstan, Vietnam, Mali, a number of places are actually contributing to that article. Queen's University is actually the location where we're, and there will be actually having some conversations about that in the coming days. UBS Optimus Foundation actually helps support the initiative in Beirut. The Open Road Alliance did as well. And there we have Dr. Ghassan's programs, the Arab Resource Collective and the Early Childhood Action Network, and all of the people that have been helping, as well as the H&M Foundation and my university, Yale University. So with that, I think I'm done, and I'd just like to thank everybody for listening in. And if you have any questions, don't hesitate to contact me, and I'm sure that we can post my email address on the website. But thank you very much for your attention, and I hope I didn't go too far over time.
Thank you, Dr. Lechman. To Dr. Fitzpatrick, it is clear that early childhood services are highly beneficial for young children. In your experience, how can early childhood services also benefit or empower families and communities in fragile contexts? Dr. Fitzpatrick.
Thank you, Rima. I just want to open my slides. I hope you can see them now. Thank you very much, Rima. Excellencies, distinguished guests, I'm really delighted to be able to contribute to this panel discussion this afternoon. Thank you, Rima, for this very important question and reminding us of the importance of early childhood development, not only for children, but also for families and communities. We know now that investment in high quality early childhood services can lead to important societal and family outcomes and can lead to more peaceful society and cohesive and inclusive societies. I would like to briefly share with you the Bronfenbrenner model that we have adapted in the International Network on Peace Building to remind us of the importance of seeing not only the young child as a focus for ECD, but also the family and the wider community. And this significance of ECD as a potential for community and societal change has been recognized, I think, by the group of 20 and in the Sustainable Development Goals. Quality early childhood services that operate from a community development focus will engage and support parents and engage with the wider communities in which they operate, and see this as a critical democratic process, not just as an add-on or as a nuisance to what happens in the classroom. Early childhood services operating from this community development perspective can support more harmonious and pro-social behavior in families, and in doing so, support the type of positive parenting and nurturing care framework that James has alluded to in his presentation. Early childhood services operating from this community development perspective can also support and build resilience, promote social cohesion, and build and sustain connections between families and the wider communities, especially in divided, conflict-affected society. And we now can see many positive examples of this, especially during this current COVID pandemic and in areas affected by conflict. For example, colleagues in the Palestinian Child Institute have been able to strengthen their support for parents with children on the autism spectrum by developing a range of home-based solutions. And services in my own region, Northern Ireland, linked to the Early Years Organisation, have been able to maintain cross-community services within very divided communities now during the pandemic, and especially have been able to provide physical and emotional support for rural families who've been isolated as a result of the pandemic. Early childhood services that have remained open have provided critical support for parents to engage in frontline essential work and maintain economic activity. This has been of significant importance, especially in medium and low income communities, particularly for low paid workers who are often women. We also know now from an increasing body of research and from the programmatic developments in the international network from peacebuilding and elsewhere that early childhood services can contribute to building peace, maintaining peace, and promoting reconciliation within and between communities. Of critical importance is the ability of the early childhood services to develop local solutions that are culturally appropriate. And we can see, as Jim has alluded to, for examples from Colombia, Israel, Kyrgyzstan, Tajikistan, and elsewhere, where early childhood development services have been able to support parenting initiatives, provide family support, and strengthen community connections throughout the current pandemic. But we know, however, for early childhood development services to provide this type of family support, then they must have a clear vision and a strong set of democratic values, have a robust approach to quality, and I think, Rima, you highlighted this, and also foster equity and inclusion. But they also need strong financial and policy support from local and national governments. Unfortunately, the current pandemic has highlighted the weakness in early childhood systems, which depend in the main on a private approach to service provision, or, as we have already heard, have been weakened as a result of conflict and fragility. However, we know that where there are strong policy systems that promote integrated, inclusive early childhood services, then those services will be good, not just for children, they'll be good for families, good for communities, and good for society, as well as promoting peace and reconciliation. I hope, Rima, I've answered your first question.
Yes, thank you very much. How can we ensure these strategies, you mentioned a little bit, are inclusive, equitable, and help build cohesive societies?
I think civil society organizations must continue not only to provide innovative ECD solutions during this ongoing pandemic, but we must continue to strengthen and sustain our advocacy efforts in the short, medium, and long term with local, regional, and national governments. We must use the body of both qualitative and quantitative evidence to support all levels of government develop inclusive early childhood policies and practices, and ensure that services are funded adequately so that they can promote inclusion and promote a culture of peace. Civil society organizations must also advocate for a commitment to human rights and the rights of the child, which unfortunately have been undermined during the current global pandemic and also undermined during the current massive outbreaks of violence around the world. We need to advocate strongly that gender equality, inclusion, empowerment of children, parents, caregivers, and communities, and integrated early childhood services are at the center of all COVID-19 responses and recovery efforts. Unfortunately, during this current pandemic, the poorest, most disadvantaged families and communities, rural families and children with additional needs and rights have suffered most and have been most impacted by the closure of early childhood services. We must advocate for greater support for online and offline resources to support home-based services and the families and communities that they support. And in particular, we must ensure that governments at all levels prioritise investment in the survival, development and protection of children living in situations of conflict, military occupation and displacement. Unfortunately, children and families living in fragile, conflict-affected societies were already living in very precarious, fragile environments. The pandemic has made difficult situations untenable. Above all, civil society organisations must ensure that governments continue to protect and prioritise investment in early childhood programmes, and that they do not forget the commitments made in the Sustainable Development Goals. I would like finally to refer our audience to the Early Childhood Peace Consortium COVID-19 Call for Action and urge you all to use the document to be advocates for young children, families and communities, especially families and communities in fragile, conflict and post-conflict environments. Thank you, Rima.
Thank you very much. Thank you also for bringing gender equality, which goes hand in hand with also children's rights. Thank you very much. So now I go to Dr. Al-Attar. In humanitarian crisis, and particularly for COVID-19, what are the key needs from the field for early childhood development? And what is UNICEF doing in response to this crisis of care and learning? Ms. Al-Attar?
Thank you so much, Rima, for the wonderful introduction, and thank you so much to the organizers and to fellow panelists. And thank you for the opportunity to really speak about what UNICEF has been doing in response to COVID-19, this pandemic. I'd like to start by emphasizing that the crisis of care and learning is unfortunately an endemic and chronic crisis, that it's not new. It's not something that the pandemic has created, but as many of our colleagues already mentioned, it is a crisis that the pandemic has exacerbated significantly. We know that this crisis has led to an interruption of early childhood development services. We know that it has led to increased stress due to health concerns, just the very concern of being infected, infecting others, etc. Job insecurity, of course, is very important, especially for parents who are caregivers who are taking care of their young children and others in their families. And all of these things negatively, we know that they negatively affect the ability of parents and caregivers to provide nurturing care, which Dr. Lekman mentioned in the earlier presentations. Now, why is this all very important? As a global community, we have set goals. We have set sustainable development goals. And in order to reach them, we do need to, invest in each of these goals and ensure that we are on track. And something like COVID-19 certainly, challenges us all in terms of our ability to reach the SDGs and our global commitments. I'd like to just mention briefly SDG indicator 4.2.1. which is around children under 5 years of age who are developmentally on track in health, learning, and psychosocial well-being. All components that are very critical to young children and part of the nurturing care framework, which was presented earlier. Now, in terms of what UNICEF is doing, at the very beginning of the COVID-19 response, there was a surge and a need for just very basic demonstrations of hand washing, how to use masks, and eventually guidance on the use of masks, especially for children. We had developed content for children. So prior to COVID-19, certainly not all children who need it, but more children had access to facility-based learning, play-based learning opportunities in childcare centers, etc. And this COVID-19 situation created a large gap in those services. And there was a need to create contextualized early learning materials and content that is available and accessible to them in their homes or through mass media, television, radio, WhatsApp groups and other forms of communicating with families and young children. There was also, in the beginning of the crisis, an extensive need for guidance for parents on how to speak to their children about COVID-19. And UNICEF has a parenting hub, very easy to find, UNICEF Parenting on the internet. And there you can find a tremendous amount of resources on how parents can talk to their children about COVID-19, ideas and activities for parents to engage their children with at home to support their learning and development in the absence of services that they had access to previously. Of course, there was also a need for guidance on reopening of childcare centers and other institutions, including preschools. There's also a great need for persons with disabilities, both children and caregivers with disabilities, need for support and guidance for them in these circumstances. And then, of course, tips and activities for children to promote their early learning and development. And very importantly, as was mentioned by many of the colleagues previously, is how guidance on how parents and caregivers can look after themselves, because we know that the well-being of parents has a direct impact on the well-being of children. So in these challenging times, it is very important for us to be supporting caregivers, to be ultimately caring for caregivers. And then, of course, there was a need for guidance to employers, various types of employers, on how they can support their workforce, many of whom are young parents with young children, to provide the mental health, psychosocial support services needed, the flexibility that is needed to ensure that they can take care of their health, their families, and while also fulfilling their commitments to their employer. I will talk a little bit, Rima, about what we are working on. What we are working on is to ensure that all parents and families ultimately are empowered to provide safe opportunities for quality learning for their children, the provision of nurturing care, including safe environments, and the provision of inclusive and equitable play-based learning and responsive caregiving opportunities. If I were to choose two things to really emphasize in this entire session, I would choose I would choose responsive caregiving opportunities and play-based opportunities, because we know that play, responsive care are critical in children's overarching development, in their physical development, their psychosocial development, their brain development. And unfortunately, in crisis contexts, including the situation that COVID-19 has created, these opportunities are often limited and or challenged. They are already challenged. That challenge is exacerbated by these types of situations.
Mm-hmm.
I will also talk about advocacy briefly. Of course, part of our work is to support and raise levels of awareness
Mm-hmm.
for all stakeholders to support parents and communities in the provision of nurturing care, caring for the caregivers, which I've mentioned earlier, to support the psychosocial, mental health and psychosocial well-being of caregivers and parents, and then supporting key prevention measures as well, and immediate response activities at the country level. There is a great need for contextual response to ensure that families and communities are able to provide safe, engaging play and learning environments for young children. I think that answers your first question, Rima,
Mm-hmm.
so I will
Yes.
defer back to you.
Thank you, Nada. On a national scale, what could countries lose by not investing in early childhood development, especially in the crisis setting now and in the trying times that we are having now?
Thank you so much, Rima, for that question. And Dr. Lekman also addressed this a little bit earlier in his talk.
Mm-hmm.
The cost of inaction, cost of inaction is quite high. We know that the cost of inaction has economic impacts on the average earnings of young children as they grow up, as they become adults. We know that there is a cost to healthcare. We know that there is a direct link between investing in young children and early childhood development interventions and opportunities and improved health outcomes. So without that investment, we see, decreases in health outcomes and a need for increased cost to the healthcare system, as well as lost learning potential, which also taxes the education systems and has a high cost in terms of trying to catch up later on in life. And of course, there are implications for sustainable development and the building of peaceful and socially cohesive societies. And that is backed up by a lot of science, research, and many of the statements made earlier in the presentation and will be made. We also know, that for every $1 US dollar invested, spent on ECD, the return on investment can be as high as 13 US dollars. So when you look at that, it's very significant, and that is directly from Dr. James Heckman. Rima, if I may, I just wanted to emphasize one more point,
Yes, please.
about everything that we're talking about here.
Yes.
I think it's important to keep in mind that we are not talking about early childhood development as a bonus or a plus or an added thing. These are fundamental rights of children to adequate nutrition, to health, to education, learning, to protection, to development, and I would specifically emphasize to responsive care and to play-based opportunities. For them, these are extremely critical. So over to you, Rima. I hope it's okay that I added that last piece.
Thank you, Dr. Attar. And I would really like to thank you and thank UNICEF for their effective response after COVID-19 to children, and to really mobilize the world to work with children in these very trying times. Dr. Ghassan Issa, you have seen firsthand the devastating repercussions of a humanitarian crisis, such as the Beirut blast, amplified by the COVID-19 pandemic, on families in the region and in Lebanon. How well are the needs of young children and their caregivers being met in humanitarian aid efforts? And what are the implications of this? Dr. Issa?
Thank you, Rima, and thank you for ECPC and C20 for giving the Arab region this opportunity. Let me start by saying that in most of our Arab countries, and for tens of years now, we have been facing chronic multi-layered crisis conditions with recurrent acute exacerbations of poverty and wars, affecting all aspects of our people's lives. This humanity crisis is jeopardizing all political, economic, and social determinant systems, ending up with overwhelming poverty, unemployment, social injustice and non-cohesion, wars and civil conflicts, and leading to civil deaths, refugees, internally displaced, destruction of educational and health systems and facilities, and of course, food insecurity. These consequences are generating an urgent need for continuous humanitarian assistance. It is a human rights crisis where health for all, education for all, child's rights, and the rights for dignity and the values of democracy are all jeopardized. The COVID-19 pandemic has only exacerbated this human rights crisis that we are facing. in Yemen, for instance, in Syria, in Sudan, in Libya, in Lebanon, in Palestine, and many other Arab countries. Our young children, and starting from pregnancy and their families, are the most affected in these countries, with an increase of all types of physical injuries, toxic stress, domestic violence, gender inequity, health hazards, disrupted early learning and education, lack of security and safety, mental health disorders, imminent hunger, and malnutrition. And what's most important is that the loss of most of the children's well-being achievements gained over the past years. This catastrophic ordeal is keeping our children in the Arab region and communities unable to climb up the ladder of development, and always being dragged back to square one of children's existence, seeking mere survival. We are trying to keep our children alive. That's all. Besides, in the COVID-19 aftermath of global economic recession and the lack of global solidarity that we are seeing, even meeting the immediate basic survival needs of young children and their families and caregivers will never be attained adequately. This is what we are seeing. This is what we are facing. Over to you, Rima, please.
Thank you, Dr. Issa. What do we need from political leaders, policymakers, and the international community to have quality early childhood development services in the region and globally, and also to realize the rights of the children in the region?
Yes, of course. Let me be very frank. So long as wars, social injustice, and lack of equity are prevailing, there will be serious concerns about the short and the long-term impact of these catastrophic conditions and its COVID-19 aggravations on the well-being and development of young children, and again, starting from pregnancy, as well as their families and other caregivers. For instance, we in the Regional Arab Network for Early Childhood Development, referred to as ANECD, have learned it the hard way from our fieldwork in Arab countries among refugee children and their families, internally displaced, victims of food insecurity, violence, traumatic and post-traumatic mental health disorders, and all kinds of toxic stress impacts. The most significant entry point for community social justice and cohesion and peace-building efforts, and consequently political stability and economic recovery, is to start from the beginning, to address young children with their families and caregivers in a multi-sectoral, holistic, integrated, and inclusive approach. There is no longer place for fragmented sectoral interventions every now and then. Sustainability in these interventions is very important. And these interventions that do not approach the child in crisis as a whole in her and or his ecological surrounding. We need a holistic, integrated, and inclusive approach to child development to address these crisis problems. ANECD and the Lebanese NGO, the Arab Resource Collective, referred to as ARC, have designed and implemented such an approach, a program in Lebanon, Jordan, and Egypt called Health, Early Learning, and Protection Parenting Program, referred to as HEPPP. It is a responsive caregiving program given to families and children in difficult circumstances. And we have now tailored this HETTT to be implemented in Beirut after the August 14th blast. Okay. The issue is that it's not only, and because of the COVID-19 pandemic, it will be online. It will be, and where there is no connectivity, we will use the smartphones for it. And if smartphones are not available for families, we will go to the field in a one-to-one approach to families and children. Now, this HETTT is in collaboration with the ECPC, of course, the Open Society Foundation, the Bernard Van Leer Foundation, UNICEF, and the Yale Child Study Center. Please, I would ask the attendees to spare a minute to look at the NECD website and the HETTT documents to know more about this innovative multi-sectoral integrated program that addresses children and families in crisis situations. Now, political leaders, policymakers, and the international, regional, and national communities are urged to recognize the vital need to keep early childhood care and development and the well-being of families and caregivers on top of the global agenda for direct and long-term humanitarian efforts and support. It is not an issue to be done in addition to others. It is an emergency. ECD is an emergency these days. This needs a global solidarity movement among governmental institutions, civil society bodies, academics, activists from different countries, regional and international networks, institutions, and UN agencies in the field of early childhood care and development to ensure that all children in all countries and communities enjoy their rights, happiness, and well-being in an enriching environment of freedom, social justice, and equity. Thank you, Rima. Over to you.
Thank you, Dr. Issa. Thank you also for all your work after the blast, the humanitarian aid to families and to children. And now we go to Dr. Tenorio. Dr. Tenorio, we heard about the importance of parents and families and civil society. What other key actors are well positioned at community level to reach and enable positive behaviors in providing early childhood development services and nurturing care, leading to a more cohesive, peaceful society? Dr. Tenorio?
Thank you, Rima, so much for that question. And thank you for your kind introduction. For the organizers and the fellow panelists, it really is an honor to be part of this group. And thank you for all those viewers that have made time on their Saturday to join us. And for those that will join us in a recording, we really appreciate you spending time with us. Your question, Rima, is extremely important. Also thinking about all what our fellow panelists have highlighted, that families, children are experiencing challenges that have been exacerbated greatly by this COVID crisis. We cannot underestimate that. I'm sure everyone in this call has felt it in one way or another, but most vulnerable families are facing great challenges. And when services are interrupted, trusted community networks are extremely important to be able to reach most vulnerable families. When we don't have health, nutrition services that are provided normally, and many times we're weak to begin with, the community structures that are trusted can reach families in ways that those structures can't with agility when a crisis hits. This is why World Vision acted very swiftly and really called a global response to the COVID-19 pandemic as soon as the declaration from WHO came out. And we partner across the world with many governments, but also community networks that we knew could reach families as fast as we could. And I want to share with you, if you allow me, an example in a video of a partnership that we established through our Channels of Hope programming with faith leaders around the world. So I will be back with you in a second after this short video.
There exists a global learning crisis exacerbated by the COVID-19 global pandemic. Due to the pandemic, 1.6 billion children have been disrupted from school, and at least 40 million children are missing out on preschool globally. Never before has the importance of caregivers been so evident. Caregivers are children's first playmates and educators. This role has become more significant as families are isolated at home with no access to formal education or playful learning opportunities. The changes to mobility, outside care and education have left caregivers feeling isolated and overwhelmed, placing children at risk of not developing to their fullest potential due to a lack of play-based learning opportunities and increased household stress. World Vision is responding to this need, engaging caregivers in picture-based playful parenting messages. These messages are being provided daily to an estimated 80,000 caregivers via an engaged group of 17,000 faith leaders with whom they have pre-existing and trusted relationships. We aim to scale these efforts while also aiming to develop pre-recorded audio messages hosted on Viamo's hotline service that caregivers can access through simple or smartphones. These messages will be recorded by faith leaders and will contain ideas for play-based learning, games and materials that can be made within the home. The messages will also contain psychosocial support messages for the caregivers, providing prompts towards self-care and healthy behaviours. Why should we engage faith leaders? Given that 84% of the world's population adheres to a religion, an effective way to influence social norms is to engage diverse multi-faith leaders in the efforts to build understanding of and appreciation for meaningful play experiences in the home. As a faith-based organisation, World Vision's programs uniquely positioned to engage effectively with the community's diverse faith identity. Through the power of technology, caregivers can feel surrounded with support from those that they trust, empowering them to provide their children with playful learning opportunities within the home.
So I hope I gave you, in a short way, an illustration of how we partner with different community networks. I did want to illustrate why faith leaders a little bit more, because as you heard in the video, 84% of people adhere to a religion, which means that faith leaders can reach communities in many places, especially most vulnerable families, families that may have very poor socioeconomic background, children with disabilities, from ethnicities that can be discriminated upon. So one important part of this, and it's part of your question, Rima, is that faith leaders can influence social norms, attitudes, and behaviors in ways that other leaders perhaps are not as positioned to do so. In many communities, faith leaders can dictate which behaviors are acceptable and which behaviors are not. And they can be champions for inclusion and for girls' equality. The other part is that in some places, faith leaders may not be aware, may not have the information, the resources to advocate for ECD, and unwillingly may harm the advancements of ECD. So by engaging faith leaders, they become very effective champions, and we have seen this happen. The other very important part is that we heard the families are experiencing very stressful situations, like never before. And so faith leaders can reach these families with support, with care, in a relationship of trust. And in these interactions, they're also encouraging caregivers to take care of themselves, because if they don't take care of themselves, they cannot take care of their children. So this is truly important. The other part is that effective advocacy from faith leaders on peaceful and social cohesive societies is unparalleled. We have worked in a do no harm approach with faith leaders, where you can access more information through the links that we share. But we know that if faith leaders emphasize unity and not what separates us, they can be a very effective advocate for peace building. So this is just, Rima, an example of how other community actors can engage. Just want to highlight that it's not only faith leaders. The country where I come from, Honduras, we have partnered with community child protection committees, with youth groups, with municipalities in the prevention of violence. Because as we heard from Dr. Leckman, the early experiences of adversity and violence can have incredibly harmful results in child development. So those networks are really being successful in ensuring more harmonious and peaceful societies with families. So I can go on with more examples, but we don't have time. Thank you.
Thank you, Dr. Tenorio. This is a great example of how strengthening community involvement can create enabling environment for young children outside of the formal systems. UN Secretary General, His Excellency Antonio Guterres, recently said, and I quote, "Governments must prioritize equal access from early learning to lifelong education. Neuroscience tells us that preschool education changes the lives of individuals and brings enormous benefits to communities and societies." End of quote. Dr. Tenorio, how could access to formal and informal early childhood learning intervention help to achieve lifelong education for all?
Thanks for that important question, Rima. And I know that my fellow panelists have answered that question indirectly in some ways. But I think it's very important to emphasize that we are experiencing a crisis of care and learning like never before in history. 1.6 billion children out of school. Can we wrap our minds around that? 40 million children are not accessing preschool education. And we know that in the early years, timing matters. And if we do not have access to those children to these services, we may lose a window of opportunity for children to learn. We know that a great deal of our brain architecture is shaped in the early years. I don't have to go into the details. Dr. Lehman did that. Our capacity to learn, to adapt to change, to psychological resilience, a lot of those skills are formed in the early years. We know that learning begins at home. And we heard from our fellow Nada that sensitive caregiving, responsive caregiving, playful parenting experiences are paramount. And so we need to ensure that that is supported. We understand that when a child's brain does not get what it needs at the opportune time, correcting that is much harder. It doesn't mean it can't happen. We all learn. We are examples of it. If not, we wouldn't be joining this panel. But the results can be less optimal if we are not acting now to bridge that gap. And so I just want to close saying that while we have the scientific argument, we know the education, the investments, the economic arguments. You can see them in my slide. Nada shared them. Dr. Leckman shared them. The most important imperative is the moral imperative. Education, development, protection, those are rights. And we need to ensure that those rights are protected despite the COVID crisis. We need to come together as a global community to be creative, to look for solutions, and solutions for those that are most deprived, for families that are at the outskirts. We heard about the crisis settings and how those are increasing. So we do need to reach those children, and we can only do that together. So thanks so much, Rima, for that question, and looking forward to a further discussion with our viewers.
Thank you. Thank you. Thank you very much for all our panelists today. I know that our viewers and our audience will have many questions and comments. Please send them to our website and they will all be answered. So in our closing, I would like to ask you, Dr. Tenorio, what is one commitment you asked G20 leaders to make for young children everywhere?
Thank you, Rima, for that question. And the G20 leaders have been very have committed strongly to ECD, and we're grateful for that. But we do need to have stronger investments and concrete commitments for investments in ECD. As Nada said, this is not icing on the cake. This is fundamental. And that those commitments get to families, get to those hard-to-reach families in hard-to-reach and crisis context. So whatever is developed, let's think about those families before we create policies that perhaps are not addressing the roots of the problem and the equity problems that we have in the world. Thank you, Rima.
Thank you. Thank you very much. Dr. Isa, your commitment.
Okay. Yeah, okay.
Yes.
From an Arab region perspective, I think our planet cannot survive anymore without peace built on social justice. Wars that are affecting young children and their families should be stopped now. I think this is the most important issue I can think of. Thank you, Rima.
Thank you. Ms. Al-Attar.
Thank you, Rima. It's difficult to choose one, but I echo Anna's mention of the commitments already made. And I would just add to that, we definitely need more investment. We also need longer term investment, in programs and interventions. And I would also say increased investment in engaging communities in the development of interventions and implementation. And of course, evidence generation. We have evidence, but we do need further evidence generation, especially in humanitarian context when it comes to early childhood development. Thank you, Rima.
Thank you very much. Dr. Fitzpatrick.
Thank you, Rima. Similar to the other panelists, I want to thank the G20 leaders for what they've done to date, but ask them to continue to promote and invest in quality, integrated, holistic services for children, families, and communities, especially those families who are living in fragile and conflict environments, and invest in early childhood development in the same way as you think about investing in hospitals, schools, or roads, and recognize that early childhood services are an essential element of all of our public infrastructure.
Thank you. Thank you, Dr. Fitzpatrick. Dr. Leckman?
Well, a wonderful question, and I would have to say that the answers that have already been provided pretty much cover the entire spectrum of what I would have to say. But it's one child at a time, and our world is constantly changing. Even though we may develop a program that has been shown to be beneficial and to have long-term outcomes, it's a challenge always to be able to provide those programs, particularly in conflict-affected regions. And whatever else is true, we need to find a way of building a more peaceful world. And I do believe that if we invest in parenting and early childhood, it will be easier. But there's so much more that needs to be done. And certainly the world leaders, please, let's make a difference. The time is now.
Thank you, Dr. Leckman. On behalf of all my colleagues at the Early Childhood Peace Consortium, we entreat the world leaders to uphold the values of global solidarity, global cooperation, and dialogue among nations. Most importantly, we appeal to them to uphold the values of inclusion and social justice in our societies, which is a path to the fulfillment of the rights of all children and their families, and in particular, those that are living in very fragile contexts. And then I thank the speakers and all our audience for your valuable contribution. And I'm sure the valuable contribution could help to influence the G20 leaders' agenda. And also for the audience, if you like to share your thoughts on the C20 summit, please use the hashtag C20 summit. And also another announcement from C20 is members of civil society can still register to become members of C20 through C20 website. I thank you again, and let us recommit ourselves to children and their families. I thank you.
Thank you. Thank you all.
Thank you, Rima. Thank you, everybody.
Thank
And
you.
certainly if anyone is interested in joining the Early Childhood Peace Consortium, you're more than welcome to do that.
Yes.
But I'd like to thank all of my colleagues. Really a wonderful session. Thank you. Shukran.
Shukran.